Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Thanks for joining us for this edition of Triage. My name is Cheryl Choice. I'm a healthcare lawyer in the K&L Gates Pittsburgh office and also have a master's in public health. Today I will be joined by colleague Sarah Carlins, who is also resident in the Pittsburgh office, and Carla Dewberry out of the Seattle office, to discuss how COVID-19 has changed the landscape for behavioral health providers and what things might look like going forward. Public health experts, including those at the World Health Organization, anticipate a surge in need for behavioral health services both as the pandemic rolls on and long after. Individuals are facing increased anxiety due to the fear over the virus itself and its economic impacts, including job loss. Paired with the isolation many are experiencing due to stay-at-home orders and other mitigation strategies, it is no surprise that experts anticipate a rise in need. Certain groups are more at risk of psychological distress, including frontline healthcare providers, who are faced with heavy workloads and an increased risk of exposure. Reports out of both China and Canada show that close to 50% of healthcare workers indicate having behavioral health symptoms or needing psychosocial support. Other at-risk groups include children, older persons, and those with pre-existing behavioral health concerns. So one of the main ways that COVID-19 has impacted behavioral health in the United States is how care is delivered, with many providers now turning to telehealth to provide care for their patients. I'm joined now by Sarah Carlins to discuss the rollout of telehealth programs as well as how it might impact care delivery going forward. So Sarah, how did the rapid adoption of telehealth come about? And has the government helped providers to facilitate this process?
Thanks, Cheryl. Thank you. So obviously, telehealth rapidly expanded due to the COVID-19 pandemic and the immediate need to increase accessibility of a huge variety of medical services to patients without requiring in-person interaction for the duration of the public health emergency. And this the federal government did in various ways, including the CARES Act, the Coronavirus Preparedness and Response Supplemental Appropriations Act, Section 1135 of the Social Security Act, which allows the government to provide certain waivers of regulations, and additional guidance that has continued to come from various sources such as CMS, OIG, and OCR. And some of the major changes there were essentially that Medicare telehealth services were hugely expanded. So practitioners can now bill Medicare for traditional fee-for-service services when such care is provided via technology that has, two-way audio and video capabilities. Practitioners who can provide telehealth were expanded to include practitioners who previously could not have provided their medical services via telehealth. And the modalities for providing telehealth services have been expanded to include the specific authorization of smartphones. So CMS came out and said you can absolutely use your smartphone for this. But importantly, in the April 30th interim final rule, CMS authorized specifically the use of audio-only visits. So that means just via telephone, right? The old-fashioned landline, recognizing that some Medicare beneficiaries don't have access to smartphones or other two-way technologies, which were largely previously required for the coverage of Medicare telehealth services. Just a personal example, my parents don't have smartphones and they have a difficult time using the iPad or the computer for audiovisual communications. It's foreign to them. They don't want to learn how to do it. And a telephone call is far less stressful and therefore preferable. And this translates to communications with family members as well as their various medical providers. So there are those people out there. Importantly, in the behavioral health space, many of the services that can now be provided via an audio-only visit include traditional psychotherapy services, as well as certain substance abuse, weight management, tobacco cessation type services. A full list of the mental health type services that can now be provided via telephone is available at the CMS website and includes, helpfully, associated CPT codes for the same. And if anybody has trouble finding that and wants assistance, because that is a great resource, please feel free to reach out to me directly and I can point you to that. Along with Medicare, many state insurance commissioners have issued guidance or requests to expand the coverage of telehealth services from private payers. In addition, I think many are expecting, and indeed we're starting to see certain insurers making permanent the coverage of telehealth services, including for behavioral health providers, as evidenced by Tennessee Blue Cross Blue Shield making such an announcement just recently.
It will definitely be interesting to see if more major insurers follow suit and how coverage will be structured going forward. But Sarah, there are obviously many concerns other than reimbursement and insurance. What would you say to behavioral health providers who may be sensitive to HIPAA privacy requirements associated with providing care remotely?
Sure. That's a great question, and that's an important consideration. So associated with the expansion of telehealth, the federal government has also provided certain enforcement discretions that offer providers some protections. So specifically, the Office of Civil Rights has said that it will not impose penalties for the good faith provision of telehealth services through non-compliant means. So meaning through a modality that previously would not have been considered HIPAA compliant. In addition, the OIG suggested a list of vendors that would likely be agreeable to entering into a business associate agreement with a covered entity and to certify as to HIPAA compliance if the provider wanted to take those extra precautions. Associated with that enforcement discretion, the OIG has also said that it will not subject providers to administrative sanctions under either the anti-kickback statute or civil monetary penalty laws for reducing or waiving cost-sharing amounts owed by beneficiaries for telehealth services. So this allows our behavioral health providers some freedom to maybe provide some financial relief to patients who really need the support and assistance of mental health services, but who may have financial challenges right now, particularly in the current environment. Maybe they have lost their job or they're in a home with a primary caregiver who has.
So it sounds like telehealth is a great resource for behavioral health providers because it preserves access to care, and providers may even be able to reach more people because of the changes in reimbursement. But what struggles has the rapid expansion brought about?
Well, certainly there are pros and cons, right? So the pros obviously would include the fact that telehealth has provided a way to preserve access to care to a patient population that really needs such continuity of care. It has also perhaps in some way addressed certain barriers to access that some patients may have traditionally faced, such as maybe not being able to get a ride to their therapy appointment, for example. So in that way, telehealth has been able to offer flexibility to meet patient needs as they may arise or change from time to time. And of course, the fact that there has been an expansion of reimbursement options has been helpful to getting people the care that they need in this space. Some cons would certainly include the fact that for some patients, telehealth isn't really an option. They may not have reliable internet access, or they may not have internet access at all. And while we do have this reprieve temporarily during the public health emergency of the ability to have many of these services provided audio only, I don't think anybody expects that that will continue as widely as it is permitted now. Another thing to consider, obviously, is that people may not have privacy in the home environment in which they're sheltering in place, even if they're in a part of the country that is now, gone from full-time to part-time of those restrictions. A lack of privacy can be a big deterrent to sharing things with their mental health provider fully, honestly, and openly. And in addition, we all know through the video internet world that we've all sort of been forced into in the last many weeks, that audio-video technology is not seamless, and it has certain limitations, like glitching and delays and people not making eye contact due to camera positioning or reluctance. And this can lead to a feeling of unease and maybe alienation. So, Carla, I know you've spoken to behavioral health providers in the field about what their real-life interactions have been through the use of telehealth to provide the services that had normally been provided in person. What are some of the observations that you've seen there?
Well, they've all articulated some of the things you've already mentioned from the patient perspective in terms of technology, the access, privacy issues. In fact, one of my colleagues informed me that the only place that one of her patients could have a private conversation was in her car, where the internet access wasn't good, the phone didn't work well, and it wasn't a calming place to have a conversation with your therapist. The other kinds of things they've identified are questions about whether or not the payment level will continue to be the same as in-office payment. They're worried that eventually the system will provide lower reimbursement for telehealth calls by behavioral health therapists that are remote as contrasted with those provided face-to-face. Most of the providers are not billing currently. We've already talked a little bit about the CPT codes that are covered, but the charge codes and the modifiers that are needed to be submitted on those bills may not be consistent across all insurance companies and payors. So most of the providers I spoke to are basically sitting on their bills until they figure that out. So they're obviously going to be a delay in getting payment. Then the final thing that was mentioned to me by these providers is whether or not telehealth is a good tool when you're trying to have medication management. Interestingly, the National Institute of Mental Health came out with a report just recently that was based on a survey taken during the COVID-19 pandemic of psychiatrists, so not psychotherapists and others. And the results of that survey indicate that the psychiatrists perceived positive impacts of telemedicine, including insight into the home setting and expanded reach to certain underserved clients. They indicated several negative impacts, including reduced ability to observe nonverbal clues, and those clues are needed to support diagnosis and treatment. Psychiatrists argue that given the unprecedented circumstances, the transition to telemedicine in the early weeks of the pandemic went more smoothly than they would have expected, and patients voiced satisfaction with virtual care. But the psychiatrists also indicated that they look forward to the day when they can go back to face-to-face visits and not to a time when most of their care is delivered virtually.
Thank you both for that insight into telehealth. It'll be interesting to see how the telehealth landscape continues to change. Carla, in terms of the provider experience, those offering substance use disorder treatment have also entered into a new world thanks to COVID-19. Can you walk us through the overhaul to substance use treatment confidentiality laws, more commonly known as Part 2, and how these changes will impact providers going forward? So first, why were these changes made?
During the pandemic, on March 27th of 2020, the Coronavirus Aid, Relief, and Economic Security Act, which we refer to as the CARES Act, was passed. The CARES Act brought about some changes that have long been discussed within the behavioral health community with respect to whether or not HIPAA should more closely align with the rules under Part 2. The CARES Act does precisely that. The changes to the substance use disorder confidentiality laws will be effective and are effective currently. They will be supplemented with implementing regulations sometime later this year or the first quarter of 2021. As you may know, under HIPAA, there is a broad exception that allows disclosure for treatment, payment, and healthcare operations. The CARES Act embraces that concept to the extent that the patient consents. The current Part 2 consent requires, in most situations, a specific consent for every disclosure. That's not required under HIPAA when it's just for treatment, payment, and healthcare operations. And the new CARES Act changes would apply that same concept to Part 2 programs, provided the patient has given an informed consent. The rules do restrict the use of the disclosed information in certain situations where it would be adverse to the patient, but CARES more closely aligns the disclosure opportunities for Part 2 programs with the rules that are applicable under HIPAA. This is a big change.
And do you anticipate that patients will see direct impacts?
Well, I think we're hopeful that patients will not be adversely impacted by these new changes. We recognize that we're talking about substance use disorders in a very professional setting, and I would expect there would be ongoing discussion within each provider facility of that type about the nature of the consent that they want to seek from their patients. Keeping in mind that it's important for individuals who are struggling with substance use disorders to have the opportunity to successfully complete these programs without fear of unintended consequences. Their practitioners are well aware of that, and I expect that there will be robust steps taken to protect the interests of their patients. That's my expectation. I think that's my hope of what we'll see in the future.
Thanks, Carla. What takeaways do you have for providers related to Part 2?
I think the big takeaway is that they should begin to think about the circumstances and content of the disclosure that they may seek from their patients. To the extent that they have an ethics committee, which I would expect many do, this might be a topic for the ethics committee to consider in advance of the time that they actually roll out these consents. But I think that's the important work for them to be doing right now.
That's a great point. I just want to take the time to thank you, as well as Sarah, for taking the time today to discuss these important changes for behavioral healthcare providers. As we know, the behavioral health system in America has always been fragmented, but the disruption caused by COVID-19, coupled with the likelihood of increased need, both now and long after the pandemic ends, have provided providers and regulators with the opportunity to think about alternative models for care and move the system toward a more streamlined and accessible future. The World Health Organization emphasizes that the pandemic presents an opportunity to build a better behavioral health system going forward. If you have individual concerns regarding the healthcare landscape during the pandemic or how changes may impact practice going forward, K&L Gates has a strong team of lawyers dedicated to understanding the healthcare universe and providing clients with timely insight to assist in their ability to deliver the best care to patients. Thank you for joining us today.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.